day everyone, I am Jocelyn Poblete, a student nurse from Biliran Province State University. So for today's video, I will be performing newborn assessment. So the purpose of this video is to assist if the baby, if it is in normal condition or experiencing problems like deformalities and complication. The equipments that I will be using are sterile gloves, stethoscope, bulb syringe, thermometer, and pen light. So the purpose of wearing gloves is to ensure the infant's safety and by not touching any liquid fluids such as Vernix caseosa. Now, the first thing to do is ensure the baby's safety in the crib. There should be no harmful objects that may harm the baby. The only thing that should be beside the baby's foot is the bulb syringe. So the use of bulb syringe is to clean any presence of mucus in nose and mouth. Then the next is the proper way to do is to use bulb syringe on the mouth first. Then next is the nose for the purpose of reducing aspiration. Next is verify the patient's information if the patient's name and birth date are similar and ask permission to the parents for the assessment. So the first thing before touching the baby is noticing how the baby is acting right now. So the baby is sleeping, it only means that she's not in pain. Now the first thing to do is auscultate. So we're gonna use the bell of our stethoscope. So we're gonna listen to the heart. A normal heart rate is between 110 to 160. So it's very important to listen for 1 full minute. Next is listen to the baby's lungs, side by side. Next is respiratory rate. While listening to the lungs, we could take respiratory rate, then bowel sounds, of course. Babies do have bowel sound after 30 minutes of life. The big three vitals are heart rate, temperature, and respiration. Since we're done with listening, now we'll start with head to toe. Let's take off the baby's hat. And just take your hands and run over their head. Okay, now we're done with the head. Let's go to the eyes. We will use pen light and shine it on baby's eyes. Now let's check the mouth. So if the baby sucks your finger, then she's doing a sucking reflex. And that's rooting reflex. Moving down, checking the baby's neck for bibbing, maybe vernix are hiding. Next is chest. Is there any discoloration? Checking skin, arms. So it's normal for babies to be skinny. When we check fingers, we count it 1 to 5. So each fingers, we will count 1 to 5. 1, 2, 3, 4, 5. Check palmar grasp. So, okay. Working an hour down, check the legs, the feet, and count fingertips. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So, common abnormalities on feet is when you have extra feet that can be done by surgery. When we up baby's toes, okay, we can do the plantar grasp. Next is Kubinski sign. Checking legs if it's fair. And now, check diaper area. If this baby is a girl, and that term baby, you might see a little white stiff in the vaginal fold. That's called smegma. And that's normal. It's fine with the baby. Don't scrub or wipe it off. Also, baby girls sometimes have pseudo-menstruation, which when changing diapers, you see little blood in the diapers. That's okay. That's mom's hormones circulating through babies, and that's normal. If this is a boy, we're gonna be checking the penis, the meatus where urine comes out. So that should be on the tip of the penis. It could be on the other side, which is hypospadias, or in the top, it's called hypospadias. So both things are not normal and needed to be checked. If baby is circumcised, we're gonna give proper instruction to the mom. We need to test testicles and make sure it's descended. So if we see that the urine is super dark, sometimes they mistake it as blood, and that's okay, that urine concentrated unlike uric acid crystal. When it comes to bowel movements of the baby, meconium is like greenish black and tar-like, very very sticky. Sometimes even wipes can take it up. As baby grows and starts eating, it's gonna vary depending if breastfeeding or formula, and that's considered normal baby. It can be brown, tarry black, green, and yellow. So I'm gonna wrap up the diaper back and make sure it's below the umbilical cord. Okay. And so we will assess the site to the redness, swelling, or any drainage or bleeding. Now let's check the baby's back. So check for curvature of the spine and check the booty and look for Mongolian spot. That's the normal mark. Its color is yellowish or blush. And lastly, we will check the temperature. Now, let's do the documentation and do aftercare.